My name is Terry, and I'll be doing today's presentation. I'm a project director with iplanit. I come from a social care background, particularly in person-centered planning, predominantly within learning disability support services, but also float support and some complex services as well. Today's webinar is mostly an introduction to iplanit, and then looking at referral, which is a module that is part of the iplanit system. But we'll look at a couple of things, but it's mostly about referral and how the information around the person is kept on iplanit and the importance of that to the system. And then webinar 2, which is the 27th of March, so please sign up for that. Where we really get into the mechanics of iplanit and how it works. So we're going to be looking at plans, how plans work on iplanit, how outcomes are set, how you can make outcomes from plans, reviewing those plans and keeping on top of that, and notes and logs, and then a couple of periphery abilities of iplanit around that. And then finally, webinar 3, which is April 24th, we're going to be looking at more of the management side of things, the KPIs, the dashboard tracking, KPI tracking, evidence and incident management. So the kind of the big reports that you want to get from iplanit. Okay, so first, if this is the first time you've come across iplanit, let me just quickly give you an overview. iplanit is a flexible and modular cloud-based system, so that's quite a mouthful. What that means is iplanit is on the internet, and you can tailor iplanit to meet your needs. It's not kind of like a cookie cutter system. We adapt it and change it and configure it to how you work. There are modules you can add on or not use, depending on what your needs are. It's not specifically around learning disability, although back in 2011, when we first started iplanit, 2010, 2011, it did focus on learning disability, but that footprint has really expanded now because of the principles of the iplanit system, which I'll show you in the next slide. But at the moment, it's enabling thousands and thousands of support workers and care support delivery and service leaders across the world to deliver on their promise to the people they support, which is to improve people's lives. It's a tool to help a provider organize itself so it can help and improve the lives of the people it supports, keep them safe from unnecessary risk. It offers transparency, which we'll have a quick look at today, to the loved ones of the person supported. They can access their plans and outcomes, track their own progress. So there's a real enablement aspect to it as well. And then behind that, as that is happening, behind that, there is lots and lots of powerful reports that iplanit can generate, which can really help validate your services, help funders see where the value for money is, help you organize yourself as a provider. So iplanit is kind of founded in person-centered practices. It has an integrated approach to what I was saying before, evidence and value, capturing impact, outcome reports, and so on. So evidence and value at the point of support and being able to put that into powerful reports at a management level. Inclusion, so people can access their own plans, they can access their own outcomes, they can track their own progress. There are calendars people supported or patients can access. There's lots of different ways to include it. Family can be included as well. So there's a real, which leads on to the next point about transparency. Now that's transparency with family members and with the person supported, but also in and amongst the organization as well. There are notifications. It helps collaboration, the risk management is there as well. And then finally, that leads on to accountability. So, there are things that we need to do, and we need to say when they're done or why they've not been done, or what direction the service is going in, both on a direct support level, on a mid-manager level, but also on a strategic level for the organization. So these values we have about evidence and value, inclusion, transparency, and accountability, these are the values we've based iplanit on, which is why it's not limited like it originally was to learning disability. It has a footprint that expands through any high quality support. And this shows how systems, those things I've just read out on the bottom there, how the system can really help propel values, that can help support values. We don't like to think of iplanit as just a computer system. It really is a tool to help progress the values of the organization, to help that accountability side of things, that can really help the values of an organization progress, but be accountable to them as well. It's not just a paper exercise. So if we had like a bird's eye view of iPlanet, it would look like this. So the circle in the middle, the green circle, is what we call core iPlanet. And that is what every rollout of iPlanet gets. So any provider who starts to use the iPlanet service, they get those center circles as the core iPlanet, which covers a lot. Firstly, it covers plans towards the top right there. You can upload documents and document management workflow. You can put your own systems into iPlanet. It tracks outcomes, which if it goes to the opposite side of the circle leads into the key performance indicators. Those two things can be linked together, the direct support aspect of outcomes and people achieving their goals and dreams, and support being delivered to deliver safe support, and all the things that you need to evidence on a direct support level, but also on an organizational level. So the outcomes and KPIs are linked there. We'll have a look at that in detail in our last webinar in April, but we'll be looking at outcomes in a lot of detail on the next webinar. There's an alert panel keeping everybody informed, letting you know if some things are overdue, letting you know if something needs to be signed off and things like that. There's an internal messaging system, a dashboard, which is generally where staff spend most of their time on iPlanet. We'll have a quick look at that today. I'll show you what that is. And that really helps the staff member, whether they're a direct support worker or a senior manager, helps them organize all the information that's on iPlanet. Because there is quite a lot of information that goes on there. There's a filing cabinet, so if there are things like tenancy or GP notes or anything like that, you can upload those documents and there's somewhere safe to put them, so that you don't have lots of multiple systems. iPlanet really can become a place that you can put a lot of the information around a person. And then the outside circle, the blue boxes, they're the kind of the add-ons, the modules that you can add on. So we're going to look at the top one today, referrals. I'm going to briefly show you around needs assessments as well. And the other modules, you have surveys, calendar, clinical care planning, support tasks, which we'll look at in the second second webinar, fund and budgets, track and staff qualifications, a new module that's just come out, event incident management. We'll be looking at that in the last webinar. And then location management, which I'll explain a little bit more in a slide in a couple of seconds, but location management is around tracking things like equipment or PAT testing or safety procedures, the things where it's not really about the person, it's about where they live or equipment that they use or something along those lines. We need to keep track of those things anyway, and there's a place to put that on iPlanet, because what you'll find with iPlanet is it's based around the person, but then there are also spaces there on iPlanet to put the things that are a bit more location based. So if there are a couple of guys living together and they share some of the same equipment, or some of the electrical, like the PAT testing, for example, is a really clear, simple example. If things need to be PAT tested, you don't have to fill out a PAT testing form for each individual. There's one for the location, and that is linked into different people. So there's a lot of thought gone into how we can put information onto iPlanet and how that can kind of reflect and really be a useful tool rather than a burden for your organization. So roughly there are three levels of settings across outcome, all of it configurable. So if we start with the managers at the top, so these are some of the benefits and configurable aspects of iPlanet. This dashboard we talked about, it has a unique data set, pre-packaged reports to demonstrate compliance and evidence and value. So if you need, say for example, if it's the Care Quality Commission and they're asking about one of the key lines of inquiry, their CLOEs, you can create a report specifically around that key lines of inquiry with the people you support. And that kind of principle that applies across all sorts of different key performance indicators. There's no silos. I think that's really important, and hopefully you'll see that over the next couple of webinars, that everything is integrated. Everything is connected as well. So, and this is the point of these next three webinars, is that all the functions across the client life cycle from intake to either moving on in another service. So for support and care teams, the direct support workers in that middle management role, there are lots of templates for support, frameworks configured to the provider. So a big part of when you roll out iPlanet is configuring your plans to reflect how you work, because every provider plans slightly differently. And they all have their own values that that go into that planning process. iPlanit recognizes that, and you can configure all of your plans to be reflected in iPlanit in that way, so that when staff, your direct support staff or your care staff, see the plans on iPlanit, these are things that they recognize. So other things for other tools for the person supported and for the care teams are calendars, plans, risk, outcomes, person-centered features and values throughout the program. And then for the person supported, the patient or carer, family carer, for example, inclusion and accessibility, that's the main thing. They can see the plan whenever they want. They can access the plan as long as permissions are given. They can access the plan anytime, which just gives a real level of accessibility and transparency that's difficult to do with paper and requires time from providers to be able to communicate with family. So it kind of takes that burden off. Not that it replaces communication, it just gives future communication a bit more focus. So we looked at the whole system approach here. Now on the outside you can see different versions of iPlanit, because iPlanit's constantly updating. We update it about every year to 2 years. Updates are always included in your package anyway. These are free updates. You know, we want to keep the system as up to date with browsers and so on as much as possible. But we're always identifying ways we can improve iPlanit. We also have a system for providers to make suggestions about things that could be worded differently or put in different places, or they found this works really well, but that could be a bit quicker. And we have a forum for people to feed that to us, and we're constantly including that in the development of iPlanit. So that's why we have different versions there. But we're going to start over at client referral, assessments, risk management, care and support plans, tracking the outcomes, budgets, contracts and calendars, all the way around to the kind of the monitoring the staff activities and the staff training and competencies, and then incident tracking, which will be in the last webinar. Which will ultimately, all of this provides management information. So that's kind of a little bit of a circle of how these webinars are going to go. And once you have all of that information, once you're tracking all of this information, it helps inform staff supervisions, as we mentioned, KPI tracking. You can offer client surveys, funding reports, client demographics, which we'll look at today with the profiles of the person supported, and then risk management, which we'll cover mostly in the next webinar. But there are lots of different dashboards and also lots of different reports. You can run surveys with the people you support. There's a financial module that you can access, and also user reporting can really help with supervisions. So there's a lot of information that goes into iPlanit, and if you think as your staff, as your support workers are interacting with the people they support and delivering that support and following the outcomes and tracking the outcomes, and kind of lots and lots of light touch interaction with the person supported and the iPlanit, it's all of that information gets collated into here and gives you some really powerful reporting, which leads on to how that can inform strategy. So, I mean, the more information you have about what is going on at the point of support, the more you can direct strategy. You can review where you are as an organization in terms of what's working and not working, what direction you need to go in, what training you need to give. So having the service user in that blue center, so having the service user profile data, which is what we're going to look at today, plus the assessments and the planning and the progress as to how they're getting on with their outcomes and so on, plus the KPI data, the big broad, which is this is roughly what our webinars are like. We're looking at that top one today. Next time we're looking at that middle one, and lastly in April we're looking at the KPI data. That's almost the structure of the next couple of webinars. That feeds into lots of different things. You know, you can then have a loop of information as to how you can constantly improve, because you have up-to-date information about what's going on in your services. And if you think now with a paper-based system, there are lags there. So what can happen with a paper-based system, which you probably all know, is you make a plan and then it gets reviewed in 6 months and then it gets reviewed in another 6 months. But unfortunately, sometimes it creates a culture of constantly looking back as to what's happened. So there's a lag. So it can lead to a delay in that informing strategy. It might be a year before you've collated all this information. It's quite static information, usually in Excel sheets or something similar. And it's this culture, this rear view mirror planning culture. Whereas with iplanit, you can see what's happening right now, and you can look at what the information is about the things that are happening in your services as of that day. And that's a key difference. That's where iplanit becomes really powerful. The fact that it's so up to date. And then just lastly, before we move on to the demonstration, wanted to kind of explain the difference that iplanit has against other systems. So a lot of systems now can be online, and we'll do lots and lots of things. But the difference with the iplanit system is the way, the architecture of it. So on the left, you have a traditional forms-based support plan, which can be paper-based, but also a lot of online systems or care systems look like this as well, where it's about filling in forms and being able to access those forms. And that's what the left is, but there's no interconnectivity there. And it's usually based around the staff member. So it's who this staff member supports, what work this staff member has done, what risk assessment this staff member needs to read, and it's all kind of based around staff, which has its value, but leads to a model that is very, very difficult to expand, and it's very, very difficult to build on. And it's about the staff and not the person supported, which might sound a bit person-centered, a little bit fuzzy, but when you look on the right-hand side, the interconnectivity of having the architecture of the system based around the person makes the system very, very powerful, because staff come and go. We don't, reports on staff are important, but it's the reports on the person supported that is key, because firstly, we want their lives to improve. Secondly, the funding is around them, and so on. And there is lots of reports you can get from staff about staff as well. But it's all connected because the whole system is based around the person. When it comes to elements of the plan, KPIs, outcomes, risks, it's all around the person. That really removes that silo approach to a system. So you don't access, let me see all the risk assessments, you access the person and see what their risk assessment looks like. And there's a key difference there. So that interconnectivity is really, really important. And that's just kind of highlighting the point there. So it's the person. If you put the person at the center of the architecture of the system, it makes the system very, very powerful. Because ultimately, when you are at a reporting management level, when you are offering reports, you need the quantitative aspect, the numbers of what's happening, but you also need the qualitative aspect. And if all of your information is siloed, you're not going to be able to access that qualitative information, that level of person-centered approaches that your staff might be taking, that extra quality they put into their support around their planning and their outcomes and actions and so on. Okay, so you may have got the download that looks like this. This is just a quick little map of where we're going to go into iplanit. We're going to start on the left looking at referral, then we're going to look at where that, if a referral is successful, where that goes into the person's iplanit profile, what that looks like, what you can do with that, and then we're kind of building the basis of moving in to the full iplanit suite, which will kind of touch into the next couple of webinars.